And so I'm here to talk about things that you can do to possibly lower the amount of prescription medicines you may be taking or a family member may be taking. But in reality, the one thing that I think it's important to preface this entire workshop with is that this information is only as good as what you want the ultimate goal to be. In other words, when you give somebody a prescription medication, what you're really offering is a symptom management process. In other words, if I had eczema or I had bad acne and I might get Accutane, which makes the acne go away, but there was an underlying reason that that acne developed. Everybody agree, right? So it doesn't really matter to me if you want to even take something natural. If you're not looking at really trying to find the underlying reason that something is happening, I don't care if it's a high blood pressure medication or if it's some type of an herbal preparation. As long as you always have to take it, all you're doing is managing the symptom of it, whether it's natural or prescription. So at some point, you have to kind of get to that underlying root factor that allowed this process or abnormal function to occur in the first place. And so that's kind of the idea where the whole specialty of functional medicine came from. The idea that doctors who practice functional medicine or integrative medicine are not really trying to treat a disease per se. What they're really trying to do from person to person is identify the abnormal physiology happening within that person. It's kind of like the analogy I always use in my office is, let's say we have a large waterfall at this side of the room, and down over here on this side of the room we have a little town, okay? And that town feeds off the river that's fed by that waterfall, okay? Now, let's say one day something happens where we have an earthquake or a rock slide, and all of a sudden rocks pile into the bottom of the waterfall, and so the waterfall, the amount of water starts drying up in the river, okay? Well, what you can do is help the townspeople deal with the lack of water in a couple of ways. You could just teach them how to go without water, or you could get rid of the rocks and then let the water come back into the town and everything works fine again. You know, it's kind of like another reason that I use in my office workshops. Let's say I had a pebble in my shoe. You know, obviously every time I step on it, it hurts. Probably everybody in here has had that from a time or two. Would I rather simply take the pebble out of my shoe or just take Motrin and cover up the pain that's causing every time I step on the pebble? Right? But again, that Motrin doesn't have to be Motrin. It could be Boswellia, which is also an anti-inflammatory and pain reliever. I could take all the Boswellia I want. Guess what? I could just remove the rock. And then I wouldn't have to keep taking Boswellia, right? So whether it's natural or prescription, in some cases, is not necessarily the entire picture. It's what are you going to do with the information ultimately, and about going a step further. So to us, a lot of this is more of a means to an end versus just, here, okay, well, I can take this instead of this, and pretty soon, whether you're taking 15 prescriptions or 30 bottles of supplements every month, well, what's the difference? You know what I mean? So what I'm going through today is I'm going to discuss the most common conditions that are very easily preventable by yourself in your own home without relying on your doctor all the time to do it for you, and the most common medications that are prescribed in the United States, and probably for most of these common conditions, and some things that you can do about those to switch out in the short term. As an example, in our office, anytime somebody goes off of prescription medication, they certainly probably will go on something more natural. But again, the intention is that they don't need to even rely on the natural thing over the course of time. I mean, there was a time in human history where we could manage most problems with diet, right? And exercise. And somewhere along the way, we just got ingrained to take pills all the time, whether they're healthy or prescription or natural, whatever. The point is you shouldn't always have to take pills. So if there's a message I can send home with you, it's not just switching to something natural. It's about ultimately making the changes necessary so you don't have to be on anything, pill-wise. Okay? These are the conditions we're going to discuss today. High blood pressure, cholesterol. Nobody in here has that, right? Any of these? Back pain, diabetes, asthma / allergies, hypothyroidism. Now, I have to confess, we tell people all the time in our office about food-grade hydrogen peroxide, and yet I left it out of this presentation. So I'm going to talk about it since everybody jogged my memory, so I appreciate that. And then also hypothyroidism. Actually, the biggest thing with hypothyroidism that we'll get into with medication is that when people have clinical hypothyroidism, most of the time it has absolutely nothing to do with the thyroid itself. So you're treating a problem that doesn't exist. Okay. Anybody have an idea what the #1 prescribed medication in the United States is?
Lipitor.
An antidepressant, okay.
Aspirin.
Aspirin. Lipitor. Anybody else?
Coumadin.
Coumadin. Oxycontin.
That's a good one.
Okay. Anybody else? He's the closest.
Like it?
Hydrocodone is the #1 prescribed medication, obviously for pain. As of 2010, you can see 131.2 million prescriptions written for that pain medication. So obviously, chronic pain is a problem in our country. Somebody said, I think, Lipitor. Zocor is #2. Cholesterol medication. Anybody want to take a stab at the next one?
Citrate. Something for Citrate. Simvastatin.
Okay.
Blood pressure.
Lisinopril, blood pressure medication. Synthroid. Anybody in here on Synthroid? Probably a fair number. Yep. Norvasc, another blood pressure medication, calcium channel blocker. Anybody? Any takers? Prilosec. Anybody on that? Now it's over the counter, so that's going to start dropping. Okay. An antibiotic. 2 antibiotics. Metformin, glucophage. And a hydrochlorothiazide, water pill. Potassium-sparing diuretic. So, of all of these, we have what? We have #1 is pain. Then we have cholesterol. Then we have 1, 2, 3 blood pressure medications, 2 antibiotics, and Synthroid, and acid blocking medication. So, now aside from just the fact that you want to switch to something natural just to be natural, realize that every single one of these, and I didn't add it because literally the list is so long it would take up this entire workshop. But if I were to run through the side effects of these 10 medications and the vitamin and nutrient deficiencies that they cause, I literally couldn't do this presentation today. And you're welcome to Google that. There are enough objective sites associated with Medscape, PubMed, etc. that have all of those side effects, because obviously the FDA has to track all of those. Everybody read that? For those of you who can't, it says, I take aspirin for the headache caused by the Zyrtec I take for hay fever I got from Relenza, for the uneasy stomach from the Ritalin I take for the short attention span, caused by the Scopoderm teas I take for the motion sickness I got from the Lomatil I take for the diarrhea, caused by the Xenical for the uncontrolled weight gain from the Paxil I take for the anxiety, and Zocor I take for my high cholesterol. Because exercise, good diet, and regular chiropractic care are just too much trouble. But, I mean, this is obviously, this is happening every day, every day. Okay? You know, people don't have time. Trust me, I don't have time. So I'm empathetic to the fact that people are busy. And yet, this is what we do. I mean, if you can even take 10 minutes out of our day to do an activity, in fact, this is just a study done out at the beginning of this month, beginning of February, that 10 minutes of exercise a day lowers your risk of stroke by like 40%. Just 10 minutes. I mean, we're so busy today, we can't even do 10 minutes, you know? I mean, we have Blue Cross Blue Shield pleading with people to do My Healthy Blue and a lot of these other things just to get people active. And there we go, to my point earlier. And again, you can interject any adjective in here: conventional medicine, integrative medicine, functional medicine. It doesn't matter. Ultimately, the goal is to not have to be on pills, period. Okay? Okay, blood pressure. Now, does everybody understand, or has your doctor ever told you, whoever put you on high blood pressure medicine, those of you who are, has anybody really explained what high blood pressure is to you? Anybody? Okay, one person? Okay. Okay, everybody knows we have, take a normal blood pressure, 120 over 80, okay? 80 is the diastolic pressure, 120 is systolic. So in other words, when your blood vessel, if I'm looking down your blood vessel, when your blood vessel is relaxed in between heartbeats, it's the narrowest diameter of that blood vessel, okay, in terms of what they put it into terms of millimeters of mercury. Now, systolic, or the 120 number, is what happens when your heart beats and the blood vessel blows up to allow for that pressure to go through. Okay? So we have a boom, 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 boom. Okay? Now, the reason why high blood pressure develops can be for two reasons. It can be that over the course of time, the lining of your blood vessel loses its elasticity. So it doesn't contract, or doesn't expand as much as it can or could. So instead of an 80 resting, it's now maybe 85, 90, 95. And then that's where we get to our stage 1 hypertension clinically. Well, the problem is then, because it can't relax as much, the heart then has to compensate by pumping harder. So what happens? Your ventricle gets thicker and stronger to push through that loss of elasticity. Everybody follow me so far? Okay. Secondly, what can happen is once the heart starts to enlarge or get stronger, the left ventricle, now the amount of force that the heart generates every time it beats is that much more. So it drives up the top number. Okay? So pretty soon, you have to really go boom to get blood flow to the rest of your body. Okay? And of course, that's when we have heart failure, or of course that's also when we have hemorrhagic strokes, because the pressure is so great, you literally end up blowing out the wall of the blood vessel. Okay? Now, let me ask you a question. Again, whether you're on a lisinopril or you're on garlic for this problem, what do you suppose is the reason that these walls can harden in the first place?
Your diet, what you eat. Why they
Okay.
harden?
But what exactly are you eating?
Fats,
Okay. What kinds of fats?
animal fat,
Okay.
saturated fats,
Okay. And what else?
sugar.
That's one cause.
Sugar.
Sugar?
Salt.
Indirectly, yes. And then actually, I'll explain that later on. But yes, you're not wrong.
Lack of exercise.
Lack of exercise,
Depletion of collagen.
indirectly. I'm sorry?
Depletion of collagen, the stretch fiber.
Yes, but what causes that? So again, I'm trying to go up to the top of the waterfall. Right?
Hereditary? Would that have anything to do with it?
I'm going to say no. And the reason why I'm going to say no is because a lot of people are genetically predisposed to things that they never develop. So there has to be an environmental reason that something is allowed to exist.
Lack of
Okay.
exercise.
Yep, that was already said.
Sodium.
Stress was not said, but yes. One of the other reasons that we see very often in people who have chronic high blood pressure that don't respond well to prescription medications is heavy metal toxicity. Now, this actually leads into a couple of things and a couple of mechanisms. First of all, the exposure to the metal itself basically creates friction within your circulatory system. Imagine on a very, very small microscopic level that you have metal flowing through your arteries. What do you think that's going to do to the lining of your arteries? Irritate it, right? Okay. So it causes inflammation and it destroys the inside lining of the artery. The second mechanism is if you're exposed even to the tiniest amounts of a heavy metal, let's say the one that most people know, mercury. It's not simply the presence of the heavy metal in your system that determines, or I'm sorry, it's not the amount of the heavy metal present, it's whether or not your immune system reacts to it. And that's a very important point that people often forget. Because there are a lot of times, even we see clinically, that people will have heavy metal toxicity. But if their immune system is not reacting to it in a negative manner, it's not worth pulling it out of the system sometimes. Okay? Because you can create more problems doing a chelation-based therapy, as an example, if the person's immune system doesn't care about that heavy metal. Okay? And as an example, we hear a lot about vaccines and how there's mercury in flu vaccines and a lot of the additives that they add to vaccines. For example, mercury has an affinity for being stored in your brain and nervous system tissue. Okay? That happens in all of us equally. The difference is whether her immune system, his immune system, my immune system attacks that molecule of mercury or not. Because it's that attack that creates the inflammation in the body, and that inflammation is what destroys brain tissue, not the heavy metal. Does that make sense? In order for the heavy metal itself to have a detrimental effect, it has to be in sufficient quantity. And most of us, if we were exposed to mercury in sufficient quantity, we will be dead. It would be very quick, because it doesn't take much. So, if I'm going back upstream, what I want to do is I want to make these walls as elastic as I possibly can. Now, let's address some of the things people in here said. First of all, one of them was lack of activity. Again, a small amount of activity, even just a moderate walking around your neighborhood if you live in a subdivision, or trying to take the steps instead of the elevator, all these little things, the more you can increase oxygen flow through your body, the more the oxygen will actually bind to some of those heavy metals and pull them out of your system and help this tissue heal. Secondly, one of the things that we often do is vitamin C in high doses. Now, I'm not talking high doses orally, because the doses that we're talking about you probably couldn't tolerate orally because of the side effects being diarrhea and other things. One of the other things that can be done, again, assuming that it's indicated for that person, is to do chelation therapy. Chelation therapy down here, we have IV administration. You can do it orally. You can do it with suppositories, which we hate doing. We use that as a last resort. Or something else we use, which is very benign, very easy to do, and frankly nice, is to get in a dry infrared sauna and sweat out the heavy metals. Now, if we want to talk about alternatives in the short term, now again, when I get into natural stuff, again, I'm trying to look at some of this from a perspective of this is a short-term solution while we're working on the long-term problem. Okay? Because once this problem is solved, if you do the minor things to keep it solved, you shouldn't have to always be on whatever you're taking up here. Now, that's save the vitamins and mineral stuff over here, which obviously you should always have every day and replenish. But you should be getting it out of your food if you can, not from all kinds of pills for the rest of your life all the time. Spices, cayenne pepper, nutmeg. I don't know why valerian's over there. I should be in the middle. Ginger root, herbals, ashwagandha, ginseng, American ginseng specifically, hawthorn, valerian root, and stinging nettle. Nutrients, garlic or alicillin, depends on, again, the different proprietary brands will use the whole clove as a whole food supplement, or they'll extract the active component, which is alicillin. Magnesium, calcium, potassium, of course, that's what? That's the DASH diet. Everybody's probably at least heard the term DASH diet, which is what the government recommends for high blood pressure. The difference being, as an example, potassium. And potassium is probably, in my opinion, I know there's a lot of attention paid in the last few years on magnesium and magnesium deficiency, but in reality, magnesium is actually pretty easily replenished when you know where to find it. For example, Epsom salt. You can get bath flakes, just like we were talking about hydrogen peroxide earlier. You can buy magnesium flakes and bathe in that. And actually, transdermally is the best way magnesium is absorbed through the body. Some of the supplement companies make transdermal gels that you can rub Orally is actually, in a lot of cases, the least effective route because magnesium creates a laxative effect. So it speeds up transit time so you don't absorb as much of it orally. Calcium, of course, a lot of people have been talking lately about some of the calcium stuff. As people have been hearing this lately, taking calcium increases your risk of death, etc., etc. Well, some of that is the fact that it's a pharmaceutical company sponsoring a nutrient study. But some of it also is when people take calcium, they're not necessarily taking A, a form that's good for them, or B, they're taking calcium when in fact they needed something else. You know, for example, a lot of people take calcium because, you know what, I'm at or near menopause or shortly after, so my OBGYN told me to take calcium because of my bone density. Well, in fact, when they come into us and we test them, calcium wasn't what they needed at all. It might have been boron. And so, if you're not replenishing the right thing, you can take all the calcium you want, and if your body doesn't use it, your body has to store it somewhere. So where does it store it? In your arteries. And what does that do? Hardens your arteries and increases your diastolic blood pressure. Okay? Now, potassium of all of these is one of the harder things to replenish because of the volume that most people need if they're trying to treat high blood pressure especially. As an example, if you were to take a supplement form of potassium, a typical supplement pill is going to have somewhere around 100 milligrams of potassium in it, or 99 is the common. Okay? You should, if you're on the DASH diet and you're trying to treat your blood pressure, you should be getting about 4,000 milligrams a day of potassium. Okay? As an example, a banana has about 400. So anybody in here eat 10 bananas a day? No? Okay. So there are ways of getting it. You know, vegetable soups, bananas, of course. Another very big one are leeks. Anybody have leeks? We have, my wife has an awesome recipe for leek soup. A lot of the roots are high in potassium. You know, yams, purple potatoes, beets, even the yellow beets are high in potassium. Glucomannan is another one that we use quite a bit. Glucomannan is basically a soluble fiber that is used, and it accomplishes a couple of things. First of all, it helps keep a lot of the toxic nutrients or toxic chemicals in your food from getting absorbed in your body. And secondly, it acts as a very low-dose chelation effect because it helps draw in some of the toxic metals from the body because it attracts a ton of water to it so that you can eliminate it. And of course, we already talked about chelation. Anybody have a question so far? Yes?
What's the, how are we getting all the heavy metals into our body? Like by what route?
Pick. Food from contaminated soil, drinking contaminated groundwater, breathing all the junk in the air, living life in the United States, pretty much, is where we get it from. You can't avoid it. And I'm not trying to tell people, you know what, just go live in a bubble, because that's not realistic. But everybody's going to be exposed to these things. What we have to do is condition our body so that our body doesn't always negatively react so harshly to these things, and when our body does come into contact with them, that it eliminates them as efficiently as possible so they don't get stored. And that's the primary thing. And what's the number one route that they get stored is lack of fiber in the diet, which decreases transit time. So the longer food takes to go from here to here has a better chance of absorbing additional things out of the food. Does that make sense? So you want, I mean, if you go to a lot of, whether it's a gastroenterologist or internist or even a family doctor, they'll tell you it's okay to have a bowel movement once every 3 or 4 days. If you eat 3 times a day, you should have a bowel movement 3 times a day, ideally. And I realize people are looking at me like I have 2 heads. I'm like, what?
I think
But
that's a
that's the
man
truth.
thing.
What's that?
That's a man thing.
Well, it is a man thing. I don't know. I have no explanation as to why men typically have no trouble going and women do. But it is. I pride myself on my schedule of going. Let's just say that. Because I know one day I'm going to wake up and I'm going to be 60 or 70. Thankful that I still am on a schedule. When a lot of people aren't by then, and that's the problem. Because then a lot of the stuff that's in your food that shouldn't be there is now has a better chance to get into your bloodstream and cause damage. That's the main thing. Okay? Any other questions for blood pressure?
The dry infrared sauna, how does that do anything?
Well, you're just basically sweating it out, which is also why you can do it with activity also, but most people don't do high enough intensity activity to sweat it out. So the sauna is easy. The sauna is an infrared sauna, so it's not a steam sauna, so people who have respiratory problems and things like that don't have a problem with this version. And it's at a specific wavelength that actually optimally opens up the pores in your skin to allow the most release of basically metabolites, salts, toxic materials, etc. It's very easy to do. Just sit in there, read a book, sit in there 20 to 30 minutes.
It's not
Yeah.
real hot.
Okay, you said that it doesn't bother people because it's infrared. Does that mean?
It's because it's not steam.
But is there a heat involved in that?
Yep, it heats up to somewhere around 98 degrees.
That's
Is
all.
what it is in the sauna.
No, it doesn't. You can heat it up a lot hotter than
You
that.
can, but I'm saying is for optimal metal release, you want to have it around 98 degrees.
That's uncomfortable.
I don't even
I'd rather
sweat
go
at 90.
160.
I don't sweat at 98.
It's more-
You can go at 160. That's fine.
No, I mean really. I mean, should you do it to the point where your body sweats? I know you're supposed to drink a lot of water too. You drink a glass before you go in, one in, one out. No, I mean I have one.
It just doesn't seem hot.
Bear in mind, well, again, what is your goal? What is your goal?
I
Just
think
to
you-
sweat off weight?
Yeah.
Then you can do it higher than that.
No, I just thought if you didn't sweat, it really wasn't working.
How
Okay.
long are you staying in there?
Not so.
How long are you staying in there?
20 minutes at 130.
And that's a long time for that.
Even dry heat bothers me. Could I still deal with that?
Yes, because it's only 98 degrees. Yeah. Any other questions on high blood pressure?
Seems like you need blood work for any of this stuff.
What's that?
Seems like I would need blood work for any of this stuff. It's just too complicated.
Yeah, well, I mean, obviously the only way to know if you have heavy metal toxicity is to do some type of lab study. The best way to do a lab study is actually for heavy metals is to do something from the DMSA. There are other ways to measure it too. You can measure through blood or red blood cell analysis, or you can also measure hair analysis. Hair analysis we don't use in the office because you tend to the hair tends to collect from external sources that you're not necessarily getting into your body. And in the red blood cell analysis, it doesn't necessarily tell you what has the ability to get pulled out of the system, because red blood cell metals are still stored versions of the heavy metals. So yeah, we always want to test before we know.
Isn't a high caffeine diet a contributor on these high energy drinks and excessive coffee drinking?
Contributor to high blood pressure? Well, of course. It's, again, because it's dehydrating. So we had somebody over here had mentioned collagen problems associated with high blood pressure, and that's why. When you are chronically dehydrated, your collagen doesn't act like a spring anymore. It's kind of like if I were to pull a spring, it would suck back to itself after I let go. If collagen becomes dehydrated, especially for an extended period of time, when you stretch it out, it just kind of stays there. And so it loses its elasticity effect. So once the heart beats, boom, it can't shrink down as far because it's lost its elasticity. And that's from dehydration. And not to mention, too, let me go back to the picture. What is this wall made of? Anybody know?
Tissue.
Protein?
What kind of tissue?
Is it epithelial?
Is it
Endothelial lining, but in general it's smooth muscle, right? So that's basically a muscular tube. Let me put it into a real world context, into a macroscopic example. When I go to the grocery store, we all agree that, what is beef jerky made of?
God knows.
Muscle? Touche. Well, muscle, right? Now, if I were to pick up a package of beef jerky and 1 pound of ground chuck over here, they're both muscle, right? And what's the difference between the two? Water content. Okay? So if I'm dehydrated, how easy does it become to stretch a piece of beef jerky? You can't, right? Now, you can use it for this example, or you can use it down the line when we talk about back pain. When I have a lot of patients, because obviously I'm a chiropractor, when a lot of people come in to see me for back pain, I can help a lot of people right from the start by just having them drink the normal amount of water they should be drinking. And in my case, preferably alkaline water. I can make 50% of my patients totally asymptomatic in 2 weeks just by drinking alkaline water for back pain, because they're chronically dehydrated. So what happens? The back muscles are constantly tenser. They're more prone to injury, and the muscles are not as pliable and elastic. So they're more likely to cramp, they're more likely to get sore if they sit in one position for too long or stand in one position for too long, because the muscle is not pliable and stretchy, so it takes a second. Kind of like the person who says, you know, I get up in the morning, I'm really stiff, I got to loosen up, but once I get going, I'm okay. You're probably dehydrated, and there's no other way around it.
Doctor, I heard salt mentioned a few times. Did you want to speak to
Salt
address high blood pressure, causing high blood pressure? That's in my
Gotcha.
opinion, a fallacy. Did
Yeah.
you want to address that?
Well, it also depends on what type of salt you're talking about.
Right, and that's what
If you talk about table salt, sodium chloride, it's actually an industrial waste. Most people don't realize that. Just like Coumadin used to be rat poison, but we put it in a tablet, you take it, now it helps prevent stroke, or so we're told. So, if you want salt, you have to use unprocessed salt. Actually, unprocessed salt is healthy because not only does it have sodium chloride, it has potassium, it has magnesium, it has iodine, it has all sorts of trace minerals. In fact, the one that we use at our house is called real salt. And easy to buy, pretty inexpensive to get, and when you look on the back, it has something like 88 trace minerals in it, which is totally normal, unprocessed salt. Question?
That's kosher salt, same thing?
No.
No.
No?
No, another version could be like
Himalayan salt.
unrefined or unprocessed sea salt, or Celtic sea salt, as an example, or Himalayan
It's
sea
the
salt.
reddish looking salt.
What's that?
Reddish looking
That's
crystals.
Himalayan.
It's the Himalayan, but there are different, it should be multicolored actually,
Yeah.
if it's totally unprocessed.
So which is better, Himalayan or Celtic sea salt?
Well, it's essentially the same. It's more of a proprietary difference than anything. Any other questions? No?
Are you going for your second doctorate? Are you going to a naturopathic school?
No, I have enough. I have a doctor of chiropractic and a PhD, so I'm good with that. So,
What's your PhD in?
health services. More for research than anything. High cholesterol. Now, just like I asked with high blood pressure, what do you think causes high cholesterol?
Your body's inability.
Trans
to
fat.
use up-
Say it
Your
again?
body's inability to use up fats.
Not bad, but in what way?
Sometimes, I'm thinking genetic, but maybe I'm way off.
Plugging up the arteries, plugging the arteries,
But what's causing the cholesterol?
fatty deposits in the artery
Liver?
from
Yeah.
saturated fats and high.
Jet? Sorry, somebody over here said something?
Liver.
Liver?
Liver produces, isn't that where you get your cholesterol from, is your liver?
Some of it.
Yes.
Trans fats.
Yep.
Some of the dairy products, at least they tell you that.
Okay, good. Anybody else?
Stress.
Stress, absolutely. Okay, now does everybody know what exactly cholesterol is? Again, going back up the waterfall.
Fat.
Lipids?
It's a
Fat?
waxy,
No.
waxy fat.
What's that?
Waxy fat.
No. Anybody else? Cholesterol is a steroid hormone. It's actually our parent steroid hormone. Without it, your body cannot make any of your sex hormones, including testosterone and your estrogen and progesterone. It also cannot make vitamin D. Which is why, here in the northern climates, people's cholesterol tends to elevate from October to March because we don't get as much sun exposure. So your body's not converting as much cholesterol to vitamin D. One of the other things is that it's frankly, I hate to say a fallacy because I hate to be that detrimental or pessimistic about it, but there is enough doubt as to whether or not cholesterol has absolutely anything to do with heart disease. There are actually better molecule predictors of first-time heart attack as an example. For example, I know, anybody watch Dr. Oz? I know they've talked on there about C-reactive protein as an example. It's a cardiovascular inflammatory marker. But one of the things that actually better than cholesterol at predicting first-time heart attack is something called lipoprotein A. And for most people, their first symptom of heart disease is a heart attack. In fact, about 50% of all people who have heart disease, their first sign is a heart attack. So unfortunately, most people don't ever bother to know what's wrong. Well, when they get high cholesterol then, let's say you go to your family doctor, and the guideline now is it has to be, frankly the guideline keeps lowering every 2 or 3 years, but if your total cholesterol is above 200, they'll put you on some type of a statin drug, typically. Now in Europe, when they put you on a statin drug, they'll also put you on coenzyme Q10, because statin drugs naturally deplete your body of coenzyme Q10. Coenzyme Q10 is necessary for energy production. You can't have good energy without coenzyme Q10. It just is impossible. Okay? The problem then is once you are on a statin drug, if your cholesterol is lowered too much, your body cannot make hormones. So you actually throw that person into hormone deficiency because you put them on a statin drug. So again, we treated a problem that may not have anything to do with anything in the first place and created another problem in the process that's actually much harder to treat. Another way of looking at this, when we talk about the plaquing in the walls, which everybody associates with cholesterol, and just saying, well, your cholesterol is too high, so it's depositing in the lining of your arteries. Well, that's actually not true either. Again, if we're talking about the furthest upstream, we operate, especially with me being a chiropractor, I think our training is a little bit unique in that from day one, we're taught from the anatomical fact that the nervous system controls absolutely everything in your body. And your nervous system knows everything that happens in real time in your body. Okay? However, it governs as a series of short-term binary options. Now, let me explain that. Your brain is constantly in survival mode. Okay? Our entire purpose in life is to pass our DNA down to our next generation as far as our brain works. Therefore, our brain always makes decisions to keep us alive for the next hour, 2 hours, day, 2 days. Our brain is not intending, or our brain doesn't care what's going to happen to us in 20 years from now if I can't get past the next 2 days. Does that make sense? Because 20 years won't matter. So, we talked about blood pressure. We talked about metals irritating the lining of the arteries and blood vessels. Well, that creates inflammation. It creates tearing in the lining of the blood vessels. So what does your body do to help those tears? It plugs them. Okay? So when you really look at high cholesterol, or more specifically, when you're looking at plaquing of the arteries, what you're looking at is the body creating a short-term solution for an immediate problem. Because how long would you live if your abdominal aorta ripped open right now? You had about 5 minutes, right? So your body says, this is basically like drywall mud on a hole in your wall. Okay? What a lot of people do then is they'll say, okay, well, let's give you the statin drug to help try to remove some of this. So we're removing this, but you still have the tearing on the wall because you didn't do anything about it. Okay? So again, you're addressing something your body intelligently did to create a short-term solution. And in trade-off, you're allowing the other problem to become ongoing again. Does that make sense to everybody? So one of the things we always do is you have to look at this and say, what would happen if I made it unnecessary for this to be here anymore? So what would I have to do to make those plaques unnecessary?
The inflammation.
All right. I have to heal up the damage done to the lining of the wall by metals or by whatever other means, which are creating inflammation in the lining of the artery. And once that happens, this goes away because the body says, you know what, problem solved, I don't need the mud here anymore. And your body eliminates it. And actually, and it's one of the things we do right here. Works very fast, high-dose IV vitamin C or something called Plaque X. Now they call it Plaque X because the whole goal is obviously to remove plaque, but it's not physically removing the plaque, it's helping your body heal a lot of the damage done to the lining of the wall so the plaque doesn't need to be there anymore. Okay? Now, as an example, with the vitamin C, I know we talked about it with high blood pressure too and the heavy metals, but the IV vitamin C, if you're going to take vitamin C orally, back up a step, you at the high end might take somewhere between 5 to 8,000 milligrams a day at the very high end. Okay? Most people are taking somewhere around 500 to 1,000, right? By IV, you can actually get it on the order of 20, 30, 40,000 milligrams per day to allow this process to work much faster. Because the reality is, even though there's a normal recommended daily allowance for vitamin C, all of us in here at this very moment in time would have different requirements for vitamin C. And there's no way to know what everybody's is without testing it. So what you can do if you want to try vitamin C orally instead of IV is to basically do a vitamin C loading challenge, which we commonly do in the office, which is to basically take 1,000 milligrams of vitamin C every hour until you unfortunately hit a loose bowel movement. It's not a very fun test, but it's far easier than necessarily maybe doing IVs if you want to try something on your own. Once you hit that point, you times that by however many hours it took to get there. So let's say it took me 6 hours to get there, so that's 6,000 milligrams of vitamin C. You times that value by 75%, and that's your approximate tissue saturation level. In other words, that's the point at which that intake met all of the requirements for all the tissues of your body. Okay? And that will actually change over time. Because as people start to heal and start to do better, their requirement goes down. Okay? So it's good every once in a while, and people will come in and say it to us all the time. Well, you know what, I started taking 8,000 and I was doing great, and now all of a sudden I'm getting diarrhea again every time I take it. Well, now you probably only need 5,000 or 6,000. And then down, 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 down. To a nice maintenance dose of, say, 500 milligrams of vitamin C a day, which you don't necessarily have to get in a pill. You can get it in orange juice. You can get it in green peppers. You can get it in chili peppers. You can get it in jalapeno. You can get it in all sorts of dark green vegetables. You don't necessarily have to get it in a pill.
Would lemon oil be vitamin C?
Lemon oil would have vitamin C in it, yes.
Okay, I'm taking 6 drops of lemon oil in a capsule a day. I'm going to try it out and see if that helps.
Sure.
'Cause we're oilers,
Okay.
so we'll try that.
Sure. Welcome, Oilers. Increased sunlight exposure. Now, obviously, that's like saying, okay, let's go outside here today and get more sunlight. Well, I don't know if anybody's checked, but I don't really see it today. So, other ways of getting sunlight exposure, they actually make, for people who are really low, they make what are called blue lamps, which help your body produce vitamin C because it has the same wavelengths as the sun that stimulate that production through the skin. There's another very good nutrient called citronol. Citronol is actually a citrus fruit extract. And in 2 randomized trials, citronol, when taken for 8 weeks, actually lowers both blood pressure and cholesterol better than prescription medications. And it's natural. Question?
Yeah, back to the sunlight.
Yeah.
Blue light. How long do you sit? Or are you under it?
Depends on the person and depends on, again, you should also be tested first for your normal daily hormone rhythm. because it'll have effect on melatonin and serotonin. If you do it at the wrong time of the day, you won't be able to go to sleep, or you won't be able to wake up, depending. So it can create some other side effects if you're not doing it based for your hormone rhythm. So,
I have something to
good
add.
question.
Just to let you know, all our lighting in the front of the store is blue lights. So it's not as bright as some stores because they only get so bright.
Gotcha.
We have that.
Red yeast rice is another common one for lowering cholesterol. Red yeast rice, actually, a lot of people don't know, is actually the natural origin of where statin drugs were made from. So you still have to be careful with this, because people who are prone, like if they're on Zocor and they start to get muscle cramping and some of those side effects, they tell you to hurry up and get to your doctor if you're having them. You can still get those from red yeast rice if you're sensitive to statin medications. So it still might be something if you are trying to switch from a statin. This might be something to avoid if you are somebody who are getting a lot of cramping from the statin. I would probably more likely go up here to the citronal.
Richard, you said it was natural, but where is it from?
Well, I don't really know. Honestly, I don't have a question. I know it comes from Asia, but I don't know exactly. I'll have to look that up. Hormone converting enzymes. Now, as an example, we talked about cholesterol getting converted into vitamin D, getting converted into testosterone, getting converted into estrogens, progesterone. There are enzymes required to allow that process to take place. So it's not just as simple as saying, I need cholesterol so I can make this. Something has to allow this to happen. I have to have a segue here that's composed of something. Well, a lot of hormone converting enzymes are your B vitamins, as an example. So like B6 is a big one, which a lot of people don't get. And unfortunately, one that a lot of people are very deficient in don't know is B5, pantothenic acid. Another easy one and a cheap one, which I often recommend for people, for both blood pressure and cholesterol actually, is apple cider vinegar. It's not the most pleasant tasting thing to do. And now I will say too, you have to get the organic, because it has the mother, the fungus that's in it. If you get processed vinegar, it's worthless. I wouldn't buy it. So you have to get the organic version. You guys have it at the
Yes.
store? You have to get the organic version. I can't stress that enough. It doesn't work if you don't get the organic version.
And that helps with high blood pressure, especially?
Yep, we've noticed good drops in weight, blood pressure, cholesterol, just even in a month of being on it.
How much would you take?
Well, it depends on the person's size, but I typically have people do 1 or 2 tablespoons a day, and you can take it. Basically, it's however you can get it down.
So can you throw it in a salad?
Absolutely, absolutely. When I take it, I typically just put it in a shot glass, throw it back in the back of my mouth, and follow it with apple juice. That way the tastes are kind of similar, and it eliminates the burn a lot faster, and then I get it all down at once. I don't have to worry about. I have some people who will take a bottle of this, as an example, and put in 2 tablespoons of the vinegar, and then fill it the rest of the way up with water, and drink that all day. I was like, I couldn't do that. But more power to it. Yeah.
What about people with mold allergies when you talk to apple cider vinegar?
With mold allergies, well, again, it depends on what type of mold, which can be tested. And it depends on if it's an anaphylactic allergy or an IgG sensitivity. So, I can't answer that without looking.
Okay, yeah, you did. I mean, it was helpful.
Okay. Pickle juice, another one, again, which just has the vinegar quality to it. You could also, instead of apple cider vinegar, you could do red vinegar. I mean, you don't necessarily have to just, apple cider tends to taste the best. But you can do any of the non-processed vinegars. On the other side,